Welcome back, everyone. From suicide to an increase in opioid use, the pandemic has caused some terrifying results, but it's important to have a plan of action and to reach out for help during this time. I'm happy to welcome Mendi from Ignite Teens and Elemental Treatment on the show. Thank you so much for being here. You're a mental health specialist and someone we all can learn from at this point. Thanks so much for being here.
I appreciate you having me. Thank you.
So, right now we're dealing with the COVID-19 pandemic. So from a medical, physical issue, it's scary, right? We're seeing people pass away, not recover, having long-term effects. But when you talk about long-term effects, a lot of times people are not realizing the mental health long-term effects this could be having. Can you speak to that?
Absolutely. It's a scary thing to struggle with a mental health disorder in general. And then when you couple that with a pandemic, right, where you're sitting there, you're living in constant fear of death, you're seeing people around you dying. You've got a chaotic climate when it comes to politics and to life and to social media. And it really seems like the world is going nuts.
Right.
The pandemic has had a huge impact. And I'm not just talking people who struggle with mental health disorders to begin with, even people who didn't have mental disorders, or at least didn't have any reported symptoms, are reporting an increased amount of symptoms. They've said 1 in every 3 people who tested positive for COVID recently have now checked in and have reported having a mental health disorder. Frontline workers, trauma, PTSD. It's just, this has created such a climate that can create symptoms, can exacerbate symptoms. And it's really the next wave of the pandemic.
And that's scary in itself to hear that there's a completely different wave, but a result of the COVID-19 pandemic, yet linked. So I kind of wanted to get into that too, because Governor Sisolak talked a couple weeks ago about the increase in opioid use that we're seeing in the state of Nevada. Is that directly linked, do you think, to this pandemic and people just trying to stop feeling, zone out, whatever the experience may be on opioid use?
It's absolutely 1000% connected. And it's very simple. It's people don't have access to resources, right? When you're talking about recovery, one of the biggest, the tenements of recovery is having a support system, going to meetings, being able to access care. And now you're cut off from that. So you're cut off from all your resources that you had to help you deal with the everyday, and you're not dealing with the everyday anymore. Right. It's that on steroids and no support. And so, in the therapeutic field, we saw this coming for a while. We've been reaching out. We've been encouraging people to get help. We've been trying to create systems because we knew you leave a person who struggles with addiction in a pandemic without resources. It's like having someone in the ocean without a life vest. It's going to result in negativity. And therefore, we've seen an almost 300+% increase in use and overdoses. It's mind-blowing what we're facing right now.
It's so scary to hear you say these numbers, and then we get these organizations that come to us and saying, hey, we have these virtual coaching sessions or virtual meetings that people can go to, but do those have the same effect on people who are dealing with a mental health issue as an in-person, or does it work just as well? What are your thoughts?
So it's an interesting question, and I actually own a company that provides virtual services, and so I've had a good chance to look at it closely. The short of it is, if this was any given Sunday, the ability to get help from a therapist or a coach in an online environment shouldn't be all that different, and it isn't. And in fact, it can be even helpful because you don't have to leave the house, and there's more of a connection like we have right now. You can kind of see face to face. But when you take something like that and you increase it, again, with a pandemic, so now you have to do face-to-face for everything you do. And you can't get that real living, breathing support and that community the way you used to because it's a little bit more sterile in this environment. Now it starts to become a negative. And now you're having therapists report, burnout from too much of the online environment. So it's the kind of where too much of a good thing can become challenging. So while it is effective in huge doses and without mitigation and without any other alternative, it's skewing a little bit negative.
So now we laid the groundwork of everything that's kind of going on. We're just barely touching on it, but we're having a good understanding of what's going on with mental health. Now, what can people do to help themselves during this situation, especially with the holidays? You have New Year's coming up, you have Christmas, just so many different holidays. And what can people do to help themselves?
Absolutely. And I wanted to add one more piece on the mental health note, just as suicides are also on the rise. So here in Nevada, for example, there were more suicides in the first semester of high school than there were the entire year last year. And so it's mental health is absolutely a huge piece of it. And what people can do, whether it's mental health, whether it's addiction, and whether it's something in between, is twofold. Number one, it is important to know and to recognize that we are in a pandemic. And it's a funny thing to say that, but a lot of times when you feel hopeless and helpless and sad, and it feels like there's nothing else, and you want to go use, or you want to do something or hurt yourself, if you pause for a minute, you go, actually, there's a really valid reason I feel this way, right? It's a pandemic. It sucks. I'm going to struggle. It is normal for a person without struggling with these things to be struggling. And so having that awareness takes away some shame and allows you to know that, like having a cold or a broken leg, it's okay to ask for help. And that's part two, is knowing this, ask for help. There are resources out there. There are wonderful organizations out there. There are for-profits. There are nonprofits. There are treatment centers. There are hotlines. There are so many wonderful resources out there that if you know, one, that you are struggling and you recognize it as a struggle from a bird's eye view, I'm in the middle of something and it's wrapping me up, you can ask for help. And from the other side, what we can do, and I say we as in people around people who are struggling, and even if we're struggling, sometimes we're around people struggling worse, is really make yourself available and let them know that, right? I'm here for you. This is going to be a hard time, right? You're not alone. There are thousands, tens of thousands, millions of us, and we're here. We're here no matter what.
The holidays can be a triggering time for a lot of people, because you have this expectation of, oh, it's Christmas or it's New Year's, I should be happy, but I'm dealing with this grief or this depression. Is it normal to feel and accept that grief during the holiday season and just kind of say, okay, this is normal, I'm not alone in feeling this way?
So I will give you a stat, and this is not a formal stat, but this is something I've been in the industry for over 10 years. And there is a pattern of people who get hospitalized and enter treatment, and it goes as follows. Right before the holidays, if you're in treatment, if you're not in treatment, all the treatment centers, their census goes down, because everybody wants to try to do exactly what you're saying. I want to try to make it. I want to try to be normal. I want to try to be with their families, and their families try to encourage the same thing. Inevitably, during the holidays, that feeling sets in. And they're not alone, because thousands and millions of people do the exact same thing. And so there's a dip, and then right toward the middle of the holidays, right at the end, boom, suicides, overdoses, people going to treatment. It's a horrible trend, but it's a trend that shows you you're not alone. This is very common. People want to try to be normal. People want to try to be with family. There's this expectation, like you said, holly jolly, it's going to be great. But it's not that way. And more often than not, it's also partially because the families don't understand the dynamic either. And so when you have a loved one and you think they should be happy, sometimes the undue pressure doesn't just come from within, it comes from externally. And so it's really critical to be tuned in during the holidays to yourself or to your loved ones, and to realize that while everyone else is smiling and doing their thing, that those with mental health and addiction issues can smile with the best of them. But you best be aware and best check in and best make sure that they feel supported.
One last thing before we go. I know you deal with teens a lot, so let's talk about this virtual learning aspect. Is it detrimental to their health right now? Do we need to get them back in school at some point?
Excellent question. And this goes back to support, right? Teens, where do they spend most of their day, even more than at home? They spend it in school. And parents have this expectation, and it's based off the reality that kids are in school more than they're home, is that the school will be able to help them identify issues, right? How do you know when your kid's struggling? Well, you have this backdrop of school, and then you can tell grades are failing. The teachers will tell you they're not doing well, peer pressure issues. But without the backdrop, you can't necessarily tell when there are problems. And so what we're seeing is parents are missing it, right? They're at work. They're not being able to support their teens. The teens are in an online environment, but you don't get the backdrop because the school can't support them the way they do in person. And so, yeah, I'd say we definitely need to get our kids back in school, if not for the fact that at least there's some visibility for them, and that we can identify issues and then try to intervene on issues, before they get out of hand. Versus now, you may see them in class if you can track all the different screens. And then you may pick up on something and then you may be able to get them back on another screen to ask them what's up. But you're really missing the whole backdrop of a structured school setting. And I think kids need to be back in school as soon as possible.
All right, Mendi, anything else that you'd like to add before we go that you think it's going to be important for people to hear going into the holiday season?
I just think it's important to be aware. The number one difference between someone killing themselves and not is somebody else being there. Okay. The number one difference between someone overdosing and not is someone being there. You have a responsibility morally, ethically, however you view it, to reach out to people during the holidays and say, hey, if you need help, I'm here. Call me. No harm, no foul. Parents, their teens, call me. If you're struggling, if you're at a party, if you feel like the end, call me. There'd be no penalty for it. Reach out and let people know I am here. I'm here for you. There's no penalty for it, whatever you need. And look around, because you will see it. If you're tuned into it, you will see it. You will see the people struggling, and it'll become clear. That's the one thing I would say. Be aware, be proactive, and you can make the difference in saving someone's life.
Absolutely great advice. Mendi, thank you so much for joining us today.
Absolutely. Thank you for having me.